Good evening, and welcome to the M. Louise Fitzpatrick Award for Transformational Leadership. I am Melissa O'Connor, professor in the M. Louise Fitzpatrick College of Nursing, and I am delighted to welcome all of you who are in person and online. I would especially like to welcome Villanova's president, Father Peter Donahue, Dean Donna Havens, College of Nursing faculty, staff, alumni, students, parents, friends, and our campus colleagues to this very special event. I would like to acknowledge and thank the Narratil family who make this event and the Health and Human Value Lecture Series possible. I'm very pleased to introduce Dr. Donna Havens, the Connolly Endowed Dean and Professor of the M. Louise Fitzpatrick College of Nursing. Dean Havens is an internationally known nurse scientist and leader who blends her unique expertise in nursing practice, nurse work environments, collaborative leadership, and academia. She is a well-respected executive in nursing education and believes in creating a culture of empowerment among students, faculty, staff, and clinical and business partners to create an innovative nursing learning environment. Dean Havens is committed to advancing the field of nursing through research and engagement with nurse leaders, practicing nurses, healthcare organizations, as well as amplifying the voice of nursing. Please join me in welcoming Dean Donna Havens.
Thank you, Melissa. Good evening and welcome to all of you, to our Villanova University President, Father Peter Donahue, members of the College Nursing Board of Consultors, students, faculty, staff, alumni, colleagues, and friends, both here in the Connolly Center this evening and virtually across the country. It is good to be with you. I bring a special welcome to all veterans, families, and friends of veterans on Veterans Day who might be attending this evening. We extend a heartfelt thank you to all of you for your service. Especially, I want to give a greeting to our honoree, Dr. Diana Mason. Welcome to Villanova, Diana, and to the Fitzpatrick College of Nursing. I've had the good fortune of knowing Diana for a number of years, and I can attest that you are in for something special. This evening we pay tribute to the legacy of Dean Louise Fitzpatrick and her significant transformational impact on nursing by honoring another powerful transformational leader, Dr. Diana Mason. You will hear more from Dr. O'Connor about her background and sweeping accomplishments in a moment. Dr. Mason, your noteworthy body of work resonates with us at Villanova as we move forward with our strategic planning, guided by St. Augustine's urging to become who we are not yet. That is driving us. And also as we move through this pandemic to reimagine what should and might be. As members of the most trusted profession in this country, nurses have a responsibility to make things better in terms of nursing itself, social justice, health, equity, models of care, policy, and education, just to name a few. We bring diverse backgrounds and experiences and innate problem solving, leadership, collaboration, teaching, and communication skills to the healthcare system. Never have our skills been needed more. Nurses truly are the glue that holds the healthcare system together, and don't ever forget that. If you feel like you've been on the sidelines, it's time to get in the game. Very fitting, I should say this at Villanova. Give those who follow an answer. Give those who follow you an answer when they ask, what did nurses do during those difficult times? Please let all see that we speak up with powerful voices to the right audience to make a difference. Thank you, Dr. Mason, for your long-standing inspiration in this area. I'm eager to see what magic transpires because of your speaking tonight and because of the master class that you will offer tomorrow. So, keep igniting change. That's what Villanovans do, and that's what Villanova nurses do. Now it is my great pleasure to introduce Villanova University's president, Father Peter Donahue, to offer remarks. I've said it before, but I'm going to say it one more time. We are fortunate at Villanova because the university considers nursing a jewel in the crown, and we all thank you for frequently polishing that jewel. Thank you, Father Peter.
Thank you, Dean Havens. And I'm going to just put a little icing on the cake that you just said about nurses being the glue and to healthcare. I just came back from Penn Medicine. I called saying I might be late. I had a 2 o'clock appointment at the Starship Galactica. If you haven't seen that place, it's quite incredible. I don't know where they get their money, but in any case, I had a 2 o'clock appointment with a specialist, and at 4 o'clock, I was still sitting in the waiting room saying, I really need to go. And I said to the woman checking people in, please tell Dr., I'll save his name, that I'm going to have to reschedule. And she said, no, he'll get very upset at that. Just wait, we'll be right with you. So they came in, they got me, they brought me back, they took my blood pressure, did all that, and I said I need to leave by 4:30, and she said, no problem, the resident is coming in to see you right now. The resident came in, and of course, everything I have has Villanova on it in some way or another. And so he said, oh, do you work at Villanova? And I said, yes, I do. And he said, great basketball team. I said, yes. And he said, in fact, one of my colleagues loves Villanova basketball. And I said, did you go to Villanova? And he said, no. So he said, what do you have to get back for? And I said, I have a talk I have to be at 5:30 at the nursing college. And he said, oh, I'm dating a Villanova nurse. And I said, really? And he said, what do you do there? And I said, I'm the president. He goes, I'll be right back. In comes the doctor. Sorry to keep you waiting, Father. So I'm not sure it was the basketball team, but I really think it was the dating the Villanova nurse that did it, because he was going to go home and tell her, guess who I met today? So it's an honor to be here this evening and to celebrate the legacy of a dear friend and a remarkable Villanovan, Dean Louise Fitzpatrick. As I've said before, Louise had many families. Of course, she had her own biological family, but she also had the Augustinian family, and most especially Villanova family, and more especially the Villanova nursing family. And I'm sure she is smiling down someplace right now on us all gathered here together and online as we bestow an award in honor to Dr. Diana Mason. When I think of Louise, I cannot help but think of the expirational impact that she had at Villanova, its graduates, and the world at large. Consider how many people Villanova nurses have served, cared for, and saved over the past 18 months alone. Louise was an incredible leader. She was kind, but tough. She was tough. She was tough. She was kind, and she was tough. She was smart and innovative, and most importantly, she was extremely dedicated. She was dedicated to her students, to the faculty, and to Villanova and what it stands for. And like any good nurse, Louise was always thinking about the whole person, the mind, the body, and the spirit. She understood that nurses are a critical part of the patient's experience, and she made sure that our Augustinian values of unitas, veritas, and caritas were an integral part of their studies. This is what separates a Villanova nurse from other nurses, and we have Louise's legacy to thank you for that. With almost 40 years of service to our community, Dean Fitzpatrick will be remembered as one of the most transformative leaders in Villanova's history. As a pioneer in her field, Dean Fitzpatrick worked tirelessly to transform the College of Nursing into the premier nursing program it is today. She invested her personal and professional time in developing new partnerships, programs, and initiatives that educated students in a forward-thinking way. Her vision for a Villanova nurse was realized as graduates of the college are able to meet the current and future healthcare needs of our country and of our world. Generous and driven, Dean Fitzpatrick measured her own success through the accomplishments of many, many others. She could always be seen beaming with pride at the achievements of her students and her alumni. Dean Fitzpatrick loved the field of nursing, the college, and her students, setting the bar high for herself and for all of those around her. She placed great value on relationships and caring for others, and wanted her students to go forward and ignite change as leaders at the forefront of modern healthcare. Such a distinguished career in nursing and a life dedicated to Villanova's mission deserves special recognition, which is why I'm delighted that the college has chosen to honor Louise's legacy with this award. And I offer my sincerest congratulations to tonight's recipient, Dr. Mason. The award you receive tonight is named in honor of a true powerhouse, so I think it's safe to assume you must be one as well. Thank you.
Thank you, Father Peter. I now have the great honor of introducing Dr. Diana Mason, the 2021 recipient of the M. Louise Fitzpatrick Award for Transformative Leadership. The recipient of this award must demonstrate transformative leadership resulting in a change in nursing or healthcare, have a visionary perspective, a commitment to excellence, and a concern for human dignity, ethics, service, diversity, the underserved, vulnerable populations, and social justice. Furthermore, the recipient must be nationally and globally known and reflect the values and mission of Villanova University and the M. Louise Fitzpatrick College of Nursing. Tonight's recipient embodies all of these things. Dr. Diana Mason is the Senior Policy Service Professor at the Center for Health Policy and Media Engagement at the George Washington University School of Nursing, and is also Professor Emerita at Hunter College, where she held the Rudin Endowed Chair and founded the Center for Health, Media, and Policy. Dr. Mason is the Program Director for the International Council of Nurses Global Nursing Leadership Institute, a past president of the American Academy of Nursing, and former editor-in-chief of the American Journal of Nursing. She has produced and hosted radio programs on health and health policy since 1985, and currently hosts HealthCetera, a blog, radio, and podcast platform that provides evidence-based news, analysis, and commentary by diverse, dynamic, frontline experts discussing the latest real-world impact of healthcare and health policy. Dr. Mason has served as the only health professional on the National Advisory Committee for Kaiser Health News since its inception in 2009, and is the principal investigator on a recent replication of the 1997 Woodhull Study on nurses and the media, which brought to light that nurses often remain invisible in health news, despite our increasing levels of education, unique roles, and expertise. In addition to these findings, Dr. Mason conducted an analysis of journalists' experiences with using nurses as a source in health news stories. Through this work, Dr. Mason uncovered biases about women, nurses, and positions of authority in healthcare among journalists, newsrooms, and public relations staff in healthcare organizations and universities that often impeded journalists' use of diverse sources in health reporting. Dr. Mason has therefore become a trailblazer in helping journalists be more aware of their biases and has worked tirelessly to raise the profile of nursing by encouraging journalists to include more nurses as well as more women and people of color in their stories to capitalize on the expertise of nurses. Given the depth and breadth of her work and the passion and positive impact she has brought to the world and profession of nursing, we are pleased to present the M. Louise Fitzpatrick Award for Transformative Leadership to Dr. Diana Mason.
Thank you so much. This is really quite an honor. I knew Louise. She was tough, tough, tough. We didn't always agree. She may be rolling over in her grave right now, I'm not quite sure. But her dedication, I think, as was spoken to nursing education, and to Villanova. Some of us said she's going to die in her office. She was so dedicated to this School of Nursing and to this university. She really was a powerhouse. So I am deeply honored to receive this award in her name. I also want to say that you've got another powerhouse as a dean here. Donna Havens is absolutely a powerhouse. And I said to Father, I said, you know, you were really wise to get her. He said, we were lucky to get her. And so kudos to you, Donna, and Villanova, you're really quite fortunate. I also want to note that I know there are some people online, and Nancy Schartz-Hopko, if you are out there, hello, hello. We were in the doctoral program at NYU together, and she is fabulous, and I understand she's in preferment now. Yeah, we are still Facebook friends, and I always enjoy being in her company. And there's another alumni from this program who should be online there, Martha Fortune. Hello, hello if you're there. It's always good to know Villanova nurses are among your friends. I also want to call out Suzanne Smeltzer. Now, Suzanne, wave your hand there. So I don't know if everybody knows her. I assume most people in this room do, and I have a story about Suzanne. So I was the editor of the American Journal of Nursing. I do a lot of writing. Suzanne gave me one of the best lessons about writing. I went to Rutgers, and Suzanne, were you director of research then? Yes. And, pardon me? Sort of. And I took pride at that point in writing a very dense sentence. I could pack so much into a sentence and make it grammatically correct. I remember in grade school having to diagram sentence. I could pack a whole lot into that sentence. Suzanne turned to me one day and said, Diana, writing dense sentences is not a better way of writing. You need to shorten your sentences. And she was right. And thank you, Suzanne Smeltzer. I continue to write today with you on my shoulder. Thank you. Well, today, and I also want to say how much I've enjoyed meeting some of the students today and some of the other faculty. I really appreciate the discussions, including when we disagreed. That was always great. I appreciate a good disagreement and respectful disagreement. What I'd like to do today is talk a little bit about your future, the future of nursing, and the health of communities. And in my preferment, your preferment is not that you're retiring, it's that you're doing supposedly what you prefer to do. And I spent about a year thinking about what do I prefer to do. And one of the things that was really important to me was trying to get nursing, health professionals, healthcare, and the public to realize we don't need to build more hospitals. The Starship Galactica, he's still waiting 2 hours for the visit. We need to build healthier communities. And so I want to organize my remarks around that. So I want to talk about the two Future of Nursing reports, the first one in 2010-2011, and the second one that just came out this year, and why these are important. And then I want to talk about what role nursing has played in creating healthy communities and what role we ought to be playing. And then how nurses can lead in advancing health equity and the health of communities, particularly in these challenging times. And I've given the students a little bit of a preview. I want to end with some tips for you all about this is a new world, and you need to have demands and expectations and not give up on those demands and expectations. You need to hold us to a higher standard than we've been behaving at. So the first Future of Nursing report was from then the Institute of Medicine, and it was Leading Change, Advancing Health. And this work was committed to that if we're going to have the health of a population of people, the health of the nation, we have to look at nurses and nursing and pay attention to how do we build and strengthen nursing. So it talked about improving the education of nurses, and indeed we have met one of the dashboard indicators was increasing the percentage of RNs with baccalaureate degrees. We've done that. Could be higher. We're working on that. Maybe there's some pushback now. We were talking at lunch that indeed there might be some pushback on this now with a severe shortage of nurses. Second was to increase the number of nurses with doctoral degrees. We've done that because of the DMP programs largely. And there is some concern that enrollment in PhD programs is declining a bit. And yet we've worked so hard to build up these research programs so that we can hold our own at the National Institutes of Health and do so very well. So we need to watch that. We've improved state practice environments. Now I know Pennsylvania is still a challenge. I'm confident you guys can do this. And I think it's really looking at the framing and messaging for specific audiences. I was sharing with some folks that in West Virginia, when it flipped from Democratic to Republican, they brought in a nurse from Texas, Amy Anderson, who has worked with the Heritage Foundation, a very conservative think tank. She was a scholar with them. She's done op-ed writing with them. And when I want to know how to frame something for a conservative audience, I go to Amy Anderson. Well, the Campaign for Action that was charged with implementing this report called Amy Anderson into West Virginia, and she reframed their advanced practice nursing issues and helped them to get that law get the law changed in that state within a year. We've also increased the number, so the report calls for nurses to be at decision-making tables, to be on boards and task forces and commissions. And an outgrowth of the Campaign for Action work in this Future of Nursing report was the National Nurses on Boards Coalition. And that coalition is an independent coalition now, and we met the benchmark, the goal of getting 10,000 nurses appointing to boards, commissions, and task forces in the country. And we're still working to promote that. And so, you know, it makes people a little nervous when we say nurses should lead something. It always has to be we have to lead in partnership. And so one of the themes of this report was interprofessional collaboration. We already do that. We are probably the best at that, right? Those of you who are out working, you know we coordinate with social work, with physical therapy, occupational therapy, with the physicians, with admissions. We do all of that. And yet, we understand interprofessional. I think we have to take that conversation to some of our other disciplines to help them understand what interprofessional collaboration means. But this was a theme in the report because we said the reports recommended that nurses, in partnership with others, lead the transformation of healthcare. And it also called for diversity, but we didn't do so well on that. The numbers haven't really shifted in terms of racial underrepresented, historically underrepresented racial minorities and men in nursing. And so there's still work to be done. Well, the Robert Wood Johnson Foundation funded this report, and then they funded a second report because Robert Wood Johnson Foundation developed a very strong focus on building a culture of health in communities. And Susan Hathmiller, who's been one of the prime movers behind this work, has actually worked with RWJ at the end to look at, okay, where does this work on building healthy communities come into this? And started making the case that nurses are going to be key to your goal of building healthier communities. She got them to fund the second report, The Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity. This report was supposed to come out in about May or June of 2020. I wrote the case studies with a couple colleagues from my days at the American Journal of Nursing, case studies and profiles for both reports. And so I was looking, the report was pretty well organized. I thought I knew how these case studies were going to get laid out in the report, and it all changed because of COVID. The committee decided it needed to wait, step back, take a look at what did this pandemic mean for the work of nurses in this realm. And of course, at the same time, we had the murder of George Floyd and the whole emphasis on what are we doing here in this country around structural racism. And so this report responded, delayed by a year, so that it could integrate what nursing needed to attend to given the changing environment. So this report really does focus on building health equity and population health. And it's very explicit about we have to address the racism that is inherent in our healthcare system as well as our society, and it's inherent in nursing. And we have our own internal work to do on that. So DEI, diversity, equity, inclusion in nursing, this is part of this report. And I want to say that it needs to go farther than that. My colleagues are now, who are really steeped in this work, are saying it's about belonging. It's not just diversity, equity, and inclusion. It's this feeling of belonging. And I shared with some people, I sit on the board of the Primary Care Development Corporation, which is a community development financial institution, the only one in the country devoted to building primary care capacity. And we are doing this work. It's a very well-run organization. We are doing this work now. And I believe that every organization needs to be doing this work. Every school of nursing needs to do this work. And shout out to Naomi and her colleagues for the panel that you held that talked about diversity, equity, and inclusion, and your continuing conversations. Kudos to you for leading this work. This report also calls out the social determinants of health and valuing community nursing, public health nursing. The social determinants of health are something that I have really felt very strongly about. I went to my undergraduate program was at West Virginia University, and I had a public health nursing instructor by the name of Claire Milieu, who walked into class one day with a newspaper, and she gave each student a page and said, find something on this page and relate it to health. She gave me the business section. I said, there's nothing here about health. She proceeded to show me that there was so much on that page that related to health. I can relate anything to health now because of Claire Milieu. And there is the idea of health in all policies, that indeed there's very little that we do or think about that doesn't relate to health in some way, either on an individual, family, or community level. So social determinants of health, and what are nurses' roles with social determinants of health? And I'll say more about that in a moment. It also talks about partnering with others, including communities, which I do agree on addressing the social determinants of health and what's called the social needs of individuals. Social determinants of health, housing, access to food, education, transportation, these are neutral things. It's how they play out in a community, how they play out in people's lives that make them positive or negative. Social needs care are the individual level of social determinants of health. It's when I show up late to my clinic appointment because I couldn't get transportation. There's no transportation in my rural community. So both of those, understanding the nuances of those. Social needs care more on an individual family level, social determinants of health more on a community level. And then the first report called for removing practice barriers to advanced practice nurses. This report calls for removing practice barriers for all RNs. This is huge to me. For too long, we have expected the med-surg nurses to put up with stuff that they should not have to put up with. They have not been treated necessarily as equal members of a healthcare team. They have not had a voice on decision-making tables, and that's got to change. What are the barriers to having nurses in primary care practice to the top of their education and training? And I'll say more about that in a moment. So removing practice barriers to all RNs. And then strengthening nursing education. There's a whole lot in here about nursing education and the need for nursing education to rethink what it's doing. And I'll give a little bit more about that in a moment as well. So it's also has recommendations for figuring out how to pay for work in the space of social determinants of health and social needs care. And it's not just for nurses. I have social work colleagues who want to partner with us on this. They have a really hard time, and they're really the experts at some of this stuff. They have a really hard time with getting paid for their services, and they want to help us with this. And finally, because there was a little bit of attention to this before COVID, but COVID really highlighted that if we don't pay attention to clinician well-being, they're not going to stay. And because we haven't paid close attention, nurses have left and other clinicians have left. So we've got to do a better job of this. And I want to point out that the report does call for us to take care of ourselves individually, but it doesn't put the onus just on us. It says organizations, employers, have a huge responsibility here to look at how are they treating the nurses and clinicians and other staff in the institution. So clinician well-being we need to embrace, but also hold our employers, our organizations accountable for what are they doing to put in the structures and processes to promote that. I included this slide. Some of you may have seen this, but just to drill down a little bit about the difference between equality, equity, and justice. This is a slide that comes from the Robert Wood Johnson Foundation, and you can see on the left that this is equality. You're assuming that everybody needs the same thing, the same support. But you can see that for the short person, it doesn't help them to see the ball game if you give them the same support that the other two got. And indeed, the person on the left didn't even need that support to begin with. Equity is that you give people the support that they need to be successful or to be able to see the game. And you can see that all three of them now can see over the fence and watch the ball game. But social justice says, why do we have that wooden fence up there to begin with? Get rid of the wooden fence. They put up the chain link fence, everybody can see it, you don't need the boxes, everybody can participate. So we've got deep work to do on what are our fences? What are our fences like? And how do we make fences that are more transparent? And then in talking about how and where health is created, we spend a whole lot of money on healthcare. And yet, and this is an analysis in 2014, so, it's not the most recent analysis, but it was a good one that was published in Health Affairs. And it looked at what did the literature say about what created the variance in health. And healthcare accounts for only 10 to 25% of that variance. And yet, look at how much we are spending on healthcare. Starship Galactica says it all. And 2-hour wait time. So you've got this beautiful building. You've got these high-tech services, but we have some of the poorest health of any developed nation. Genetics account for up to 30% of the variance in health. And in many graduate programs, I don't know whether you teach this or not, there is a course in genetics. However, look at these other factors, socioeconomic, physical environment. We aren't teaching separate courses on those. And yet, social and economic factors account for 15 to 40% of the variance in health. So paying more attention to those factors, poverty is a huge factor here. Then look at health behaviors. So 30 to 40% of the variance in health is because of health behaviors. And you can think, see, so it's on the individual. The individual has to behave differently. Well, how do I behave differently? If there is no healthy food in my community, how do I behave differently if I can't get to my health appointments because I don't have transportation? How do I behave differently when my environment is one that's filled with violence and trauma? So even health behaviors, and that part of the variance in health is not just on the individual, it's also on society. So this is a slide that you're not going to be able to read, so I'm going to describe it. But it's from the New Future of Nursing report. And what this shows is at the top, you have this community here, healthy community. Down here is downstream. So this is upstream, this is downstream. And downstream is where the healthcare system, by and large, comes in. It's providing care when you got the health problems, right? We're putting a whole lot of money there in that area. The midstream, this area right here, has to do with addressing individual social needs. So I can't get to the clinic, so I'm getting vouchers to get transportation to the clinic. You're opening a food pantry. As in the Future of Nursing report, there's a case of at Rush where they saw that patients were being discharged without food. And so they started taking the leftover food from the kitchen in the hospital and creating essentially home packages for people to take home. So they did have food when they went home. But where the real work is going to come to create healthy communities is upstream. And that's looking at how do we get transportation. I'm living in a rural area. There is no transportation. You're talking about somebody with a substance use disorder who's in recovery and has to go get their Suboxone. And how are they going to get to the place where they get it? Why do we have these barriers up to help them stay in recovery? Some of them, they have to go to drug treatment court, and if they don't go to drug treatment court, they get thrown back in jail because we treat opioid addiction as a crime and a moral failure, not as the physical illness that it is. So it's how do we create these healthier communities and really thinking about investing. We have so much money that we are spending down here, downstream, that if we move just a fraction of that into building healthier communities, we'd have a healthier population, we wouldn't need as much health care as we have, and we'd have a much healthier nation. So, and I want to point out, I have on the slide Nurse Lauren Harden. Nurse Lauren Harden is the senior advisor, she is a nurse, for the National Center for Complex Health and Social Needs. She developed a model of complex care of patients who were referred to as high utilizers. They were in and out of the emergency room. They were in and out of the hospital. They were costing a lot of money. And so some health systems started to focus in and look at what's going on with these patients. If we could just do a better job with these patients, we could save a lot of money. And she did. She developed a model when she was at Trinity Healthcare up in Michigan. She's now with the center and has expanded her model. She now has a project out in California, I think it's Adventist Health System, where she's brought together the healthcare system, social services, and the criminal justice system. And they've looked at where are people showing up in all three systems? Who are the people that are showing up in all three systems? And what is their life story? She talks about this. What is their life story? And how do we help them to change their lives. They have transformed lives and they have decreased costs dramatically. I think in one sector it was 70% in the criminal justice system. They have decreased costs dramatically, and she's published this work. I need to get that citation from her. So this is an example of how to, and she's working with these communities to look at, do we need transitional housing? What kind of social supports do we need, et cetera. So I was on a National Academy of Medicine committee on integrating social care into the delivery of health care. I was the only nurse on this committee. One nurse. Social workers really were the organizers behind this. There were more physicians on this committee than social workers, and certainly I was the only nurse. Most people did not see nursing in this space, which is disturbing to me. One of the things that we did in this report that is replicated in the new Future of Nursing report is this model of how to integrate social needs care into healthcare delivery. So those of you who are going to med-surg or you're working in the emergency room or wherever, this grid, the 5 A's, you start with raising awareness. What is your awareness of the needs for social care? So you're asking patients, you're asking communities, what are the social needs that you have? Do you have transportation to get to your appointment? Do you have access to healthy foods? Are you housed? Are you in safe housing? And so there are 2 levels of activities. One is activities focused on individuals, and then activities focused on communities. The activities focused on individuals, the first area is adjustment. So I'm the clinician and I know you don't have access to transportation. So I'm scheduling as many services for you on the same day as I can. That's adjustment. Assistance. I'm getting you a travel voucher so that you can show up to this visit. And then on the community level, it's alignment. So you have a hospital that is working with the community on transportation issues. And in fact, in the Future of Nursing report, the new one, I did a case study of a fabulous guy by the name of Cyrus Bathaja, whose story is amazing, and I don't have time to share it now, but it's really worth reading, amazing story. He's working with United Healthcare, one of the biggest insurers in the country, on housing with communities. United Healthcare figured out if somebody who's getting who we're covering doesn't have housing, it's going to cost us more money. We may as well work with the community to invest in adequate housing. And so that's the kind of work in alignment. And then advocacy is calling for hospitals, health systems to be, and all of us, to be advocating for things like safe housing, adequate housing, and particularly these days, I don't know about your community, but my house in the Catskills just doubled in price in the last 2 years, but there's no low-income housing in the community. I don't know what we're going to do. So advocating for safe housing, for transportation, et cetera. So this speaks to what every nurse can be doing, as well as asking our health systems and calling on our health systems to be doing in this space. So where has nursing been in all of this? Flow, lessons from Flow. Flow knew you had to have good nutrition, access to nutrition, safe environment, adequate housing. She knew all of this. Put the patient in the best possible condition for their body to heal. She knew policy. She advocated for changes in the healthcare system. But, you know, she really did have this holistic view of what health is about and how it's created. And then one of my nurse heroes is Lillian Wald, who started the Henry Street Settlement House for immigrants, poor immigrants on the Lower East Side of Manhattan. And these were people who had no health care. And the visiting nurses there, if you ever go to the New York City on the Lower East Side, go to the Henry Street Settlement House. It's a wonderful place to visit. But she understood that you have to address the social and economic conditions of people's lives for them to be healthy. This is a time when children were playing in streets with carriages and buggies. Think about what's in the street. One, they were getting total contamination here from horse dung. And second, they were getting run over by these carts. She created the first playground in New York City. a safe place for kids to play. She also created a theater at the Henry Street Settlement House with the belief that for people in a community to thrive and be really healthy and well, have high well-being, they need the arts, that is connected to health. And there's so much more she did. I'm not even going to go into that. She was great. And Sojourner Truth, born a slave, advocating for freedom and human rights. She knew you cannot have health if you don't have freedom and if you don't have full human rights. She was a great orator. And that, the speaking, using your voice, this is a key lesson that we all need to take away from Sojourner Truth. We need to not be silent in these times. We need to use our voices. One of the reasons I think, and I'm running long, I'm going to do this quickly. One of the reasons I think we're in the shape we're at, where you come to a nursing school, and while I understand you're getting more in community health and public health, perhaps primary care, for the most part, nursing education is mostly acute care. And why? Because in 1946, we passed the Hill-Burton Act after World War II. All these advances in medical science, there was this realization, wow, if we had more hospitals, if we had better hospitals, we could really save more lives in the general public. So the Hill-Burton Act provided funds for communities to build new hospitals and expand existing ones. And in return, they had to provide some free care. And this went on until I want to say 10 years ago, there were still hospitals that had to do some payback in free care because of the Hill-Burton Act. But what we did is to follow suit and say, okay, we'll provide the nurses. And nursing education shifted, and nursing shifted from coming from the homes and the communities with Lillian-Wald, coming from the homes and moving into acute care. And then nursing education, that's what nursing education became. You had very little community-based care. The New Future of Nursing report is calling for us to change that. I also want to point to the Josiah Macy report on RNs transforming primary care that was published in 2017. I was co-chair of that with Tom Bodenheimer. And the role, we outline what the role of an RN could do. If you're practicing to the top of your education and training, you could be in a really exciting role in primary care. And so there are real opportunities here, and this report lays them out. So if we're leading in these times, I would ask you, what is your vision for health and healthcare and nursing? And to be thoughtfully bold, take calculated risks, step up and speak out. Now, I'm not going to go through these slides. These are the Woodhull Study. I'm not going to do it. I'll talk to those of you tomorrow about that. But know that our voices in the media are not what they need to be. We do not have the representation. We're represented in 2% of articles on health in major newspapers, news weeklies, and our own trade publications, Modern Healthcare, doesn't even use us as sources. So we are in this crisis. I just want to end with this crisis piece. We have a shortage. It's going to be severe. This is going to be a really rough period. Mandatory overtime is back, I hate to tell you. A local hospital in my rural community is doing mandatory overtime. They're canceling vacations, saying we'll pay you, and they're telling people they have to work longer hours. Well, what better conditions to have somebody want to flee that setting? Why not close some services? They're having nurses sign non-compete clauses, and somebody here spoke to that at lunch, where nurses, when you come to be hired, you're told sign here on the dotted line, and what you have signed is that if you leave there, you cannot work for a year, usually a year, in any other facility, similar facility in a certain radius. And they are taking nurses to court. You do not sign that non-compete course. You go elsewhere. Clause. You go elsewhere. And of course, travel nurses are getting higher pay, but hospitals, I hope, will get smart enough to figure out maybe we just need to start treating our nurses better and paying them better. So I think there's an opportunity here. Say no to unsafe staffing conditions and unsafe conditions in general. Demand true respect and equality. You have choices. You have choices. And don't just say, I don't like it here and leave. Say, here's what we need to do to change it, and I'm willing to help to change it. How do we make this change happen? And I want to be part of that change. And then, if they don't play, then there's lots of jobs for you out there. Look into whether the hospital is a magnet hospital. Does it have shared governance? Giving nurses a true voice in decision-making in the institution. And find out, do you have a nurse on your board? If there's not a nurse on the board of the hospital, why not? There are physicians on the board of the hospital. Get a nurse on the board of the hospital. And at all decision-making tables in the healthcare setting. So I think this is an incredible moment for nursing. It's going to be very difficult, but I don't think we should not behave the way we used to. We should not expect things to return to what they were. We need a new vision for nursing, for the health of communities, and for healthcare. What is your vision? We need, I think differently. We were talking about using LPNs, nurses' aides, going back to some team nursing. Whatever, yeah. Figure out what is the way that we're going to deliver nursing care. But what does the institution have to change? Why are we still at full capacity? Why are we still doing some elective surgeries that really could be put on hold for a while until we have a better handle on this? I would encourage you to think very strategically about moving your vision forward. And do it with a colleague. I have a dear colleague, Barbara Glickstein, who's been with me on the Woodhull Study, and we work a lot together, and we've worked together for over 40 years. We don't agree on everything, but I know she's got my back. She knows I have her back. And that kind of collegial relationship you can move mountains with. So I encourage you to figure out who's your buddy there, who's going to have your back, and you'll have their back. And then be thoughtfully bold in speaking up. This is not just shouting. It's really thinking strategically, but using your voice. We do not need you to be a wallflower. We need for you to be a thoughtful voice in the institution or wherever you're working and in society, and to use that voice to speak out and act on your vision. I was just at Sigma and made Sigma Theta Tau and had 2 minutes to make comments. And one of the things that I felt really strongly about, you got 2 minutes, you want to say something in 2 minutes. What are you going to say in 2 minutes? But what was important to me is that I feel like nursing's values are being challenged in this day. Our values of humanity, our values of science and evidence-based practice, and our values of caring for strangers. We care for strangers, and yet we're in a society where some people, I'm even wondering if they care about their families and whether they're giving COVID to their families. And so it's a strange time for us, but we can't be silent on this. We can't give in to that. We do take care of strangers, and there is value to that. That's part of community. So I encourage all of you, be bold. Those of you who are graduating or getting ready to graduate, be bold. And those of you who aren't ready to graduate, you be bold with those faculty. And remind them. Diana Mason told me to be bold, and I'm being bold. Don't be the wallflower, be bold. Thank you very much, and we're going to take some questions. Thank you. So we've got Q&A, discussion. You can disagree. I love disagreements, respectful disagreements. And on camera, on the webinar, there's a chat there, and somebody's going to monitor the chat, and we'll take questions from there as well. Yes.
Hi, I'm Caprice. We met earlier.
Yes.
We talked, but thank you for the speech. I was just wondering, you talked about just integrating the teaching of poverty and, racial injustice in healthcare. But have you seen a lot of advancements in embedding that teaching in actual nursing schools and embedding it into the curriculum? Because I think that starting with nursing will really advance it in the actual practice.
So I think we're just at the beginning of that, quite frankly. I have a woman by the name of Kenya Beard, Dr. Kenya Beard, who's the assistant provost for Chamberlain University. She was my mentee. I think she's mentoring me now. She's been ahead of the curve on this, and she had her own experience with being told, oh no, you can't go do this or you can't do that. And she's done a lot of work with what's called multicultural equity pedagogy. And one of the things that I took a workshop she did, and one of the things that she taught me, so I write a lot. I still write a lot, Suzanne. And I value writing, and I do try to teach them short sentences. And I put a lot of weight. I was teaching in a master's program and DMP programs, and I put a lot of weight on writing. And I failed a couple students because they couldn't write to my standard. They didn't get enough points. I would do things like, they did a lot of short papers, I would drop the lowest grade. And she said to me in this workshop, why are you weighting writing so heavily? I'm like, well, because they should be able to write. Well, is that all they should be able to do? And she changed. I changed what I did in terms of how much I weighted writing. I still had high standards. I still worked with students on writing. But I didn't make it so that if you really struggled in that area, that you would fail my course. That was not fair. I wanted to see improvement, and I started weighting other things and saying other things are important as well. So it's more of a holistic approach. She's now at Chamberlain and really pushing back on some of the policies that schools of nursing have, pushing back on attitudes that faculty have. She was the dean out at a community college in New York where the things that were going on were appalling. Things like a male student who had braids was told he couldn't stay. Yeah, he couldn't stay because of his hair. Now that's outrageous. So there's a lot of structural racism in the profession, and we need to change that. So I would keep an eye on what she's doing at Chamberlain, Kenya Beard, as well as, keep an eye on what's going on here. Yeah. Your colleague, Naomi, is Naomi still here? Where is she? Where are you? She's online. Naomi, all right. Can you give an update for Naomi on her DEI work here? Can anybody? Caprice, can you? No.
Diana. Yeah. Donna Havens. Yes. I just want to share, everybody may not realize, great question, that the university is mandating that every college offer their own course on race and social justice. So we are in the midst of developing the one in the College of Nursing that will deal with healthcare, just as engineering will be dealing with race and social justice in engineering, et cetera. And these will be required courses in every curriculum across the campus next year, I think, year after next.
Great. Excellent. Thank you. And I share with some people, if you haven't read Isabel Wilkerson's book, Caste, I highly recommend it. Highly. Other questions? Yeah, in the back.
Hi, Dr. Mason. I have a question online. If there is a need for more nurses and for an expansion in nursing education, why is it that the acceptance rate for nursing students who want to go into nursing and the limit for numbers of nursing students takes away the opportunity for so many individuals who are fully capable and passionate in the profession?
Can you repeat that with your mask off?
Sure. Anonymous. If there is a need for more nurses and for an expansion in nursing education, why is it that the acceptance rate for students who want to go into nursing and the limit for numbers of nursing students takes away the opportunity for so many individuals who are fully capable and passionate in the profession?
It's a very good question. I understand that there were 1,800 applications for the undergraduate program for 95 slots last year at this school. Why do they turn them away? You can tell me if I've got this wrong. You only have so much money, you only have so many faculty, you only have so many clinical spaces. And so that's not unlimited capacity. One of the things that could be done is to lobby your state house for more funds for nursing education, as well as the federal government getting more funds. And there has been a push for funding, increasing funding for nursing education during this time. And I think it's incumbent upon all of us to support those kinds of efforts. Do you have something you'd like to add?
Across the nation, people now recognize there is a massive faculty shortage, with more retiring every day. So we have to find a way to draw more faculty into academia. Then we can admit more students and provide a better education. Higher salaries, better work environment, draw more faculty in, and that's what has to happen. And government programs would be very helpful.
Yeah, good. Thank you. Good question. Yes, another one? Oh,
Yes.
Do you have somebody back here, somebody in the audience? No. Okay, go ahead.
This one is from Mary Pat. Have you seen any plans for the future of nursing, recruitment and retention, salary, and how the nursing industry will survive this time, especially from the ANA?
Well, the Future of Nursing report has charged the national nursing organizations, the leading ones, the biggest ones, ANA, NLN, AACN, I'm forgetting the others, to sort of lead the implementation of the agenda of the Future of Nursing report. I don't know the status of that. I assume that AACN, the American Association of Colleges of Nursing, and National League for Nursing are working hard on looking at how to, you probably know this better than I, working hard to expand the funding for nursing education. I also know that these are not, they are also charged with looking at how nursing education is going to rethink itself, transform itself. And so I think part of it depends upon the creativity of schools of nursing and faculty, maybe with some help from students, to think about how do we redesign ourselves in a way that's going to meet future need. We're going to be in a bad spot. We really are. But it's an opportunity for us to call for the changes that we've known for a long time have needed to be made. I don't know if you might have something else. No? Yeah? Yeah?
We had another question.
Yes?
Hi there. Thank you. I loved your presentation. I think it's incredibly relevant. I enjoyed every bit of it. Just wanted to say that. How do you recommend that we increase public awareness and get people who aren't in nursing or healthcare to care about this issue? I try to explain it to my family and they come and tell me, well, you'll have a job next year, and that's great, but I don't know how to get the point across to them that a lot needs to happen.
So, a great question. I have two responses. One is, when you go home tonight, whoever you live with, or if you don't live with somebody, who's your friend, call them up and ask them, and if you're a student, ask them what they think you did in your clinical day, or ask them what they think a nurse does. If you're already an RN, go home and ask the person you live with, what do you think a nurse, what do you think I do? Tell me what your idea is of what I do as a nurse. You will be appalled. Appalled. I heard my husband once say to somebody on the television, she's not a real nurse, she doesn't wear a white uniform. I'm like, what? Go home and start at home. Describe what you do. And you know, it was show me your stethoscope. That really was a movement for nurses to really talk about what they were doing and to describe the work that they do. Now during COVID, we've been in the media more, but what are we in the media about? And there is an analysis out of Ontario that in Canada that reinforced what my colleague Barbara Glickstein and I have been hearing from some public relations people and from our own observations. And that is most of the times when nurses are being seen in the media as a source, They're being used to describe the emotional impact and the emotional component of caring for somebody with COVID. They're not talking about the care details, the science behind the care that they're delivering. The media still doesn't see us as the experts on the science of caring, if you will. So we've got to do a better job on that. We've been working with our journalism colleagues to say, hey, wake up, there's more to nursing, and we like to tell them, if you're not interviewing a nurse for your story, you may be missing the best part of the story. But the other piece is that we have to step up. So nurses in my generation, journalists came calling, we went running. I think the younger generation is ready, willing, and able to step up and speak out. And so I write op-eds all the time to get my viewpoint out there to the public. And that is a really good venue for doing it. And I highly recommend, if you're interested in doing that, the op-ed project really helps to prepare people to write op-eds. Rush University actually brought in the op-ed project, and they were generating op-eds right and left. So the public needs to hear our voices more. Write about the issues you care about, but you have to frame them for what the public cares about. The public doesn't really care about nursing. I hate to tell you that. What do they care about? They care about their own health. They care about the health of their families, maybe. They care about whether they're going to be able to get health care. So you frame your op-ed for their interests. Don't go out there. I probably interview more nurses than any other radio program in the country. And I have nurses come say, I want to be on your radio program. I say, what do you want to talk about? And they'll say, I want to talk about nursing. Nobody cares. You've got to be much more focused. You've got to figure out what would the public want to hear. So connect your stories to their interests, how you save lives, or how a family member couldn't be with the person who was dying because of COVID, and what you did to connect the family in. Or the details of the technology that you're managing. Or working with ARDS and what ARDS is, that proning. What's that about? Talk about the science of that. Start showing the science that undergirds your practice. So I would say just elevate the conversations with your people you know, and when you have the opportunities to do so in public, whether on radio, on television, or with a print journalist, to do it. Yes?
This one is from Ms. Davis.
Can you speak a little louder?
Oh, sorry. What is your view on holistic admissions as a recommendation by AACN? And thank you for your inspirational talk.
Thank you. Applaud holistic admissions. There's research out there to show that GPA doesn't cut it. And neither do the test scores. It's sort of like what I was doing in my course with putting so much weight on writing. It doesn't speak to the whole individual. So yeah, I say holistic. Now, having said that, I have to say that a few years ago, I read a report on how a study of medical schools and how they were doing interviews. This one, how were the interviews going, and what happened when medical schools started interviewing people for entrance into medical school. What they found was that sociopaths do really well. So it's a little caution on that. Other comments or yeah.
This one is from Patricia Bradley. Dr.
Oh,
Mason.
Patricia, hello. Are you on camera? Hello.
Comment from Pat Bradley. So glad to meet you. Met two of our leaders of the MSNO, Multicultural Student Nurses Organization. Caprice and Naomi are keeping the pulse on what we need to do at Villanova to do a better job of integrating justice, equity, diversity, and inclusion into our actions, including our curriculum.
Awesome. Thank you for that, Pat. I was hoping to see you today, but I guess I'll see you tomorrow, and I hope so. I want to see you. We go back a ways. Yes?
This one's from Anonymous. I am not sure if this is a question that you can answer, but there is an effort being made to hire more professors, But is there an effort being made to hire more professors that are people of color in the College of Nursing in order to provide teaching that is more diverse and inclusive on a predominantly white campus?
So I'm going to let the dean respond to that, but I want to make a comment about that. My colleagues of color in the universities across the country, in schools of nursing, they are getting endowed chairs. They are being poached right and left. They are being offered high salaries. They are being offered moving expenses. And this is faculty who already have tenure and are sitting in an endowed chair somewhere. So it's for faculty of color, it's really, everybody wants you. Donna.
Okay. Yes, we are making a very, very strong effort to recruit diverse faculty. People of color, men.
It's your microphone went off again. Yeah.
I think the battery's.
Here's one.
We're trying to recruit diverse faculty, and just as a little bit of success, let me share. We ran 5 or 6 searches last spring and summer. And we were able to recruit, I think, 4 faculty of color and 1 man, and we're not giving up. We're doing some more now. So very important that we, as nurses, look like the populations we're taking care of.
And you have an endowed professorship.
We recruited one to be an endowed professor, yes.
And that person
Dr.
is?
Brigitte Bronner, yes.
Yes, yes, yes.
And if I could just add, you said you knew Pat. Pat Bradley is our inaugural Associate Dean
Yeah.
for Inclusive Excellence.
Yes.
Yes.
She's awesome. She's great. Well, and one more, and then I think our time's up.
This one is from Therese Collins. Can we get away from the emphasis on first-time pass rates on NCLEX? I feel like SONs across the country feel pressure to skew away from English as a second language students to help ensure they will have high first pass time rates.
Ooh, that's very interesting. I hadn't heard that before, but you may be very right on that. I don't know what to say to that. NCLEX is necessary evil. And there's a lot of pressure being put on the National Council of State Boards for Nursing right now to look at how they're going to change their testing in a way that supports the Future of Nursing report. But I can't speak to that. I don't know if anybody else can. Well, thank you so much. You've been a great group, and I look forward to toasting you at the reception. Thank you.
Thank you all for coming this evening. I trust you found it to be as inspiring as I did. I would especially like to thank Dr. Mason for your presentation, your efforts to advance nurses and the nursing profession, and for sharing this evening with Villanova University's M. Louise Fitzpatrick College of Nursing. Please take with you our appreciation of your work and our very best wishes for continued success. Thank you.